Welcome back. The Defense Department and the Department of Veterans Affairs have guidelines in place to make sure service members and veterans get consistent care. The devil may be in the details, though, of how the Pentagon follows those guidelines. Debra Draper is Director of Healthcare Issues at the Government Accountability Office. Debra, welcome. It's good to see you. You and your colleagues write in this work, the Departments of Defense and VA had jointly developed 22 clinical practice guidelines that address specific health conditions. It sounds like a success story.
Yeah, actually, well, let me give you a little bit of background. So the National Defense Authorization Act of 2017 required the Department of Defense to establish a program to develop, implement, update, and monitor clinical practice guidelines. And this also included a provision for us to see how that program is working. So just in terms of definition, clinical practice guidelines are evidence-based treatment recommendations to improve the consistency and quality of the care delivered to patients, including the military population. And one thing that it's very important for clinical practice guidelines specific to the military population, because they may have experienced differences compared to the civilian population. For example, they may have been involved in combat or exposure to environmental hazards such as fumes from burn pits. So yes, the two departments have worked collaboratively with to develop 22 clinical practice guidelines to focus on a range of issues, including chronic diseases, mental health, and pain management, among others.
You and your colleagues write, DoD and VA considered the health care needs of these populations throughout the guideline development process. Sounds like they're on the right track at doing that also. What did you find that, as I alluded to in the beginning of our conversation, Debra, where the organizations are struggling as far as implementation of these guidelines?
So there's probably a couple of key takeaways from our report. I mean, one, the good news is that they are in the process of, or they have jointly developed these clinical practice guidelines. They have 22 currently, and as I said, it's a range of issues from like chronic diseases to pain management to mental health. A couple of things, though, that each of the military services has its own process for disseminating these clinical practice guidelines, so there is no standardization or no standardized process for this. And also, the Congress directed the Department of Defense to implement and monitor the implementation of these clinical practice guidelines, and we found that there is no systematic process in place to monitor implementation. Now, one of the things that will be changing is that the Department of Defense is currently transitioning its administrative operations for its military treatment facilities to its Defense Health Agency, and officials there told us that they do plan to provide some more standardization around the clinical practice guidelines as time goes forward.
The recommendation that you're making is for that development and implementation of a systemic process to monitor these MTFs. What is the benefit that the department, and what is the benefit that the patient will receive from that standardization, Debra?
So the process is, having the systematic monitoring process would be very helpful because it would focus on making sure that variability in clinical care provided is reduced, also with the aim of improving the quality of healthcare services that are provided. And overall, the goal would be to ensure better health outcomes across the military health system.
When you looked at these different guidelines, the implementation of these different guidelines, was there anything as far as the way that they were administered that was not good or was troubling, or was it just the fact that people deliver the care different ways, different places, and that uniformity was difficult for efficiencies and so forth?
Well, I think one of the things that we focused on was the importance of that there should be more standardization in how the process works, so that to make sure there's consistency across the department and how these clinical practice guidelines are implemented and how they're monitored. And I mean, just to give you an example, is that we found that across the military services, the way that these guidelines are disseminated really varies. So The Army and Air Force told us that they have a process. It differs, but they they have different people in different levels of the organization that are responsible. The Navy told us they don't have a formal process, but really rely on notifications from clinical community. So you want to make sure that there's standardization and that everyone's getting the same information, and that, which will allow, improved monitoring and oversight of the implementation.
Just real quickly, we're almost out of time. Was it your sense from the work that you did that these are just different systems that grew up differently and that's why they're not standard, or is there some other reason for it? Were you able to even ascertain?
Well, I think historically the military services have operated very independently, and I think the aim now, particularly with the transition to the Defense Health Agency, is to create more standardization across the military health system, and this would include issues related to the clinical practice guidelines.
Debra Draper, thanks very much for joining me. It's great to have you here.
Thank you very much.